So tonight's original now with in-depth reporting on a topic we've been watching. And tonight, it's about type 1 diabetes, because over a century ago today, somebody got the first ever successful insulin injection. Before that, type 1 diabetes was a death sentence. Patients who had it would often only survive a few weeks or months after diagnosis. Very different from today, where researchers say across the country, about 16% of diabetics actually skip insulin doses because of how expensive they are. If patients have little or no health insurance, it can cost up to $1,000 a month for insulin. More recently, Democratic legislators have been celebrating a cap on the price of insulin, but some critics say it doesn't go far enough. Zinhle Essamuah has the story.
Laura Marston has type 1 diabetes.
I have to pay for this or I die in about 2 days.
She was diagnosed as a teenager.
At 14, to all of a sudden be told you have to give yourself injections, and it's very overwhelming.
And cost has always been a concern.
My first vial was $25, and now the exact same vial is $300.
She's one of over 1,600,000 adults in the U.S. living with type 1 diabetes, an autoimmune disorder where a person's pancreas cannot make insulin. Insulin prices in the U.S. remain the highest in the world, on average costing $98.70, according to one study, prompting patients to make dangerous decisions. In 2021, nearly 1 in 5 adults in the U.S. either skipped, delayed, or used less insulin than was needed to save money, according to an Annals of Internal Medicine study based on a CDC survey authored by physician Dr. Adam Gaffney.
Not taking insulin can precipitate a medical emergency.
And the risks are higher for Black insulin users, more likely to ration insulin, according to the survey. Insurance coverage matters too.
Also, people with private and health insurance also had higher rates than those with, say, Medicaid or Medicare.
As of January 2023, insulin costs are capped at $35 for Medicare recipients due to the Inflation Reduction Act. But the price cap only applies to those with Medicare, excluding more than 21 million patients. Democrats initially proposed an insulin cap for people with private insurance, but that provision was removed in August 2022 by Senate Republicans. The bill's co-sponsor, Senator Tammy Baldwin, a Democrat, told NBC News in part, quote, "No one should go bankrupt just to get the medication they need to live a healthy life." Dr. Gaffney points to pharmaceutical companies for the rising costs.
So I think we need to move beyond a system of copays and deductibles to a system where people can get the care they need, regardless of their ability to pay.
NBC News reached out to the 3 largest manufacturers of insulin, Lilly, Novo Nordisk, and Sanofi. The companies responding in separate statements, saying in part, anyone paying more than $35 a month for Lilly insulin can call the Lilly Diabetes Solution Center. In 2022, approximately 63,000 patients in the U.S. received free insulins. And despite the rhetoric about skyrocketing insulin prices, the net price of insulin has fallen for 8 consecutive years, making our insulin significantly less expensive for insurance plans. For Laura, she says the new cap is a start, but leaves out users like herself.
You know, I'm lucky. I have insurance. I'm very privileged. I still hoard the dregs of my insulin vials in my tiny Washington, D.C. fridge.
Laura, still wary of the day she may run out of insulin.
Zinhle Essamuah is joining us now. So Zinhle, you talked about the number of people who delay or skip or don't take enough insulin. That clearly and obviously has medical consequences, right?
Yeah, Hallie, and it has big ones, right? Because skipping doses, first of all, is alarming because of the number of people that we're hearing who are rationing, right? 1 in 5 U.S. adults with diabetes ration insulin, and they say they do that to save money. But Dr. Gaffney mentioned to me that there can be chronic effects of skipping doses, like long-term damage of the retina, your eye, damage to your kidneys, diabetic coma, or in the worst cases, Hallie, death. So the stakes are incredibly high, and this is not something people should take lightly.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.